Yo, what's up everyone? My name is Masud, welcome back to my channel. So in today's video, I wanted to sort of talk to you guys about, the best things you can do to prepare for your MSK Outpatients Placement and what to actually expect once you arrive. So the first time you actually go into outpatients, I know it can seem a little bit overwhelming just because of the pace of everything. It's actually, very, very quick. People coming in and out. You're expected to treat patients at a certain specific time, depending on what year you are in. So that can already, play in the back of your mind, and you might be thinking about, oh, I have to finish this in this amount of time. But the main thing is, before you the main thing is you are going to be sort of expected. There are expectations of you when you come on placement. But the main thing is to, just remember you're there to learn, and if your educator is sort of, placing too much pressure, that's something you can sort of tell them and, just remind them that you're still a student. But generally, in terms of things you can do before you actually get there is, make sure you know your anatomy. That's a thing that I always talk about in my videos. Anatomy is crucial to your treatment. Make sure you know how to sort of do a subjective assessment and objective assessment as well. So how to assess the different limbs and what you're actually looking out for, special tests, anything like that. The Physio pocketbook that I mentioned in one of my other previous videos will sort of help you out there if you need a reminder whilst you're on placement. But generally, when you go on to outpatients as a sort of on your first time, the thing is you're going to be sort of expected to do assessments. So generally, like I said, in terms of subjective assessments, know how to know what each question means and what you're looking for. So if the patient answers, know your special questions. For example, if it was an ACL sort of injury that someone, for example, if someone's come in for like a knee, for their knee, and they give you sort of special answers. For example, oh, I twisted my knee whilst I was playing football, and there was a pop, there was immediate swelling. And those sort of things should be in the back of your mind, and you should always be thinking about that, just because you have something to look out for. But if it's your first time, you're getting sort of into it, just try and learn as much as you can, and do as much work as you can in your own time as well, and over time that will sort of begin to sort of set place in your mind, and you sort of pick things up a little bit easier. But yeah, so in terms of things to so expectations when you come on placement, I think the best tip I can actually give you guys is when you go into outpatients, every clinical educator is slightly different. They have their own sort of way that they treat, assess people. So each educator is not going to be the same. So therefore, when you go into the placement, just come with a sort of fresh, open mind, and just be ready to learn, really, because you're going to be sort of learning from your educator, and really you just want to be a sponge. Just soak up as much knowledge as you can. Yeah, so as I was saying, there was a bit of a technical difficulty there, but as I was saying, so you just want to be a sponge, soak up as much knowledge as you can, talk to the other clinicians. If you're in outpatients, again, see if there's a possibility to observe another physio, possibly try and observe a band 5, just to see what level, just to gain a perspective of what kind of level you should be at. If you're a third year, or if you're a first or second year, what kind of level you should be aiming towards. And then obviously see if you can observe a band 6 or band 7, and if they have any specialities, just see if you can gain an insight into what they do. For example, it might be a burns or hands and burn specialist, or rheumatology sort of specialist, where you might be doing some hydro or something. So just generally very, very cool things. And we want to get a feel for everyone in the department. So make sure you make that clear to your educator. You want to get the most out of this placement. So observing other sort of people is key to you, is key to your learning, and is crucial as well. But that's really all I wanted to say on this topic so far. I've probably missed like a whole bunch of things to say. So if you did have any questions or anything about anything, you can sort of just message me on my social media links, and I'll sort of reply to you as and when I can. But in the meantime, I'll see you guys next time, and just give me a like, comment, subscribe, and that'll be fantastic. All right.